Alrighty. So thanks everyone for joining us today. I'm sure a few people will join the call as we get going. But for those on the call who don't know me, my name's Nicole Nixon. I'm the CEO of Five Faces, and I'm delighted today to be talking with Jimmy Foxall. He's the co-founder of Evolve Digital Health and a leading digital coaching and consulting firm. So welcome, Jimmy. I'm
Hey,
really looking forward to the conversation today about patient journey mapping.
yeah, me too, Nicole. Thanks for inviting me along.
Yeah, no worries at all. So for everyone on the call, before we get started, just a little bit of housekeeping. Please, if you want to ask any questions, feel free to use the Q&A at the bottom of the screen, and we'll try and ask some of those questions throughout the webinar. If we don't get to them all, we'll ask some more at the end. And for those that we don't get to finish all of them, we'll send an email out at the end of the session as well, so we capture all of those questions coming through. So, Jimmy, you spent so many years in public health sector and digital transformation as a CIO at the hospital and district level, which I just find fascinating that you've been able to roll into this role that you're in now. Tell us a little bit about your earlier career at the front line of the healthcare system and how it's informed you to be able to build up your solutions for the patient journey mapping.
Yeah, Nicole, it's going back quite some time. I was actually reflecting on this the other week that next year's will actually be my 25th year working within the healthcare ecosystem and how quickly that time has gone, but it's actually significant chunk of my life now.
Yeah.
And going back to when I first started in healthcare, I used to have long hair and a ponytail. It's all falling out now, I think, due to my years working in the system. But what I've really appreciated, and I think really gave me some grounding and understanding about the complexities of healthcare, as I started really on the front line of healthcare. I worked in a lot of frontline administration roles. I didn't really know what I wanted to be when I grew up and kind of found myself doing casual work within the healthcare system. I didn't know things like ED stood for emergency department or OPD was outpatient. So I really had zero healthcare literacy at all. I didn't know anything about healthcare. So it was absolutely fascinating when I first stepped into the healthcare system, working in areas like emergency departments, theaters, ICU, um, alcohol and drug services, community health, medical records departments. And really, I found because I worked in so many different areas, I was really able to learn so much about all the interconnected components of healthcare. So, what actually happens with a patient when they move from an emergency department into the ward, and what does that transition look like? And then what happens with their discharge letters from an outpatient area when that goes through to typists who are typing up letters and then sending that through to GPs, and really just kind of getting a very holistic view of the healthcare system.
Mm.
I think
Much better
sometimes
than starting from the ground up, right? And just learning all of the, every part of it probably set you up.
it did, and I was always I always felt every new area of healthcare I went into, it almost felt like I was starting from ground zero again. New acronyms, new patients going on very different journeys as well. If you're working I did a small stint working in maternity services, for example. That's very different to when you're working in a general medicine ward or something like that. So it just really gave me a lot of empathy and understanding of the different journeys that patients go through and also their families as well when they're navigating that healthcare system, but also how you need to build clinical services and healthcare services to support those different kind of journeys for patients. So yeah, I still to this day, I really reflect back on my very early days within healthcare. And I think it's done a lot in kind of keeping me grounded with understanding and really knowing what it feels like to be on that front line.
Yeah. And, you also bring in your personal experiences, don't you? Like, how do I want to be treated while I'm in the hospital? So you just do lean into those as well, just naturally, I think, because you always sort of reference back to, your own experiences. So That's great. So in patient journey mapping, I guess it involves both physical and digital interactions with the healthcare providers. How do you think we leverage these two modes to optimize the whole healthcare experience? Because it does take both, doesn't it? Digital and physical.
Yeah, it does. And I know when I first was really being introduced to looking at things like digital front doors and patient journey mapping and that whole area, um, I went to a little bit of, well, what are the IT tools that we need? And I think that was a mistake, was to take that approach. And I was introduced to some really interesting research out of the US, which was based around creating what they were calling connected care pathways. And I really loved the sound of that. So it really got me interested and curious about, well, what are these connected care pathways and how do they work? And basically, and I know there's a few analysts on the call today, but if you can almost imagine two swim lanes, and in the top swim lane is really starting to focus on mapping out what are all of the in-person and physical interactions that patients have for their care journey or their care pathway, and what does that look like from going to their GP to coming into a hospital to presenting to an emergency department to going and getting an x-ray done, etc. But what are all those physical in-person interactions with people who are supporting their healthcare? And then in the other swim lane, what they started to do was map all of the digital interactions that that person might have. And that they really went all over the place. They didn't just go, what are the digital interactions they're having with a hospital or something, or a GP. They looked at, well, what about things like Facebook groups and other Google searches that they might be doing? But what is everything that's happening within that digital ecosystem for the patient? Then they really started to map those things together. So they said, oh, look, before they go to the GP, lots of people are going to Google and self-diagnosing what's happening with themselves. Okay, that's really interesting. We might not be able to control that, but that's something that's happening. And they really started to try to map these connected care pathways for how a patient was actually navigating their own journey through these two different modalities. And one of the really interesting things they found is once they looked at that, they said, well, where are the high impact interactions, or where are the places where we can kind of play in and really try to improve patient experience, clinician experience, the journey and the flow of what's actually happening there. And one thing they really started to find really high ROI on was the physical interaction that consumers or patients were having through their healthcare journey, and what could they do in a digital modality before and after that physical visit. And they really started to craft a brand new experience connecting those three interactions together. So they didn't seem separate and disparate. They felt very seamless, and they were
As it
built
should
to
be.
be connected and seamless for the patient.
Yeah, I remember I got a lot of value out. It's probably a couple of years ago now, where you were sitting in our boardroom and we're really starting to, leap into the digital front door, and we were mapping out those physical and digital touch points, and it was fascinating. And that's just really helped us as well. So really enjoyed that process, and I'd recommend that to anyone when they're starting on this journey as well. It's just like really think about mapping that out. So for any of the viewers who aren't familiar with the concept, what is a patient journey map, and what purpose does it serve in an organisation?
Yeah, I think I find that the best way to kind of talk about these things is to show a patient journey map, Nicole. So I might just quickly share my
Yeah.
screen off. Here's one I've prepared earlier. Let me just make sure I'm getting the right screen up here. Has that come through okay?
Yeah, it's small, but I think everyone will get the idea.
Okay. So really quickly for everyone, and what I'm happy to do after this as well is send this through. There's quite a lot of information on this journey map. So down here we've got more of some detail which you can see, but just for the purpose of this particular session, I might talk to this one up here just because it can I can probably direct people a little bit more to different components of a journey map. But I think what's fantastic with a patient journey map is it's a way of providing some context for the right sorts of conversations around how you want to reimagine how healthcare services are being designed and delivered. Quite often what we can do is have a very siloed look of what's happening within healthcare. Sometimes we can have a focus which is just focused on the patient. We can have a focus which is just on clinicians. We can have a focus which is just on IT or digital people, depending on where this initiative may spring up. And it can spring up in all areas of different organizations. So one of the things we really like to do is work with organizations to really help them have a very blended and balanced approach to understand what their organization's about to go through and how they can craft experience which really optimize the patient journey. So what we've got here on this patient journey map is, and you know, this will be different for different types of journeys. This is a very generic one that we've got up on screen here. But you've got different stages of the actual journey of where the patient's going. And this is about providing some context so you can actually go, okay, at the referral stage, kind of what's going on here. And what we do is we really focus on what's the process or the steps of things which are actually happening for that patient. At this stage, they may be filling out a form. They may be getting some tests done. They might be seeing a medical professional. Then what we do is a concept we absolutely love, which is called empathy mapping. And this is really about putting yourself in the shoes of that patient and what they're going through at different stages of their journey. And what's really interesting is lots of patients actually have multiple emotions at each stage of their journey. They could be happy and scared at the same time. If somebody's just been told that they're pregnant, they can be really, really excited about that, but a bit scared and unsure of what the next steps might be. So it's not about trying to stop those emotions. It's about to have more of an awareness of what that actual patient is going through at that particular stage of the journey. And the way we use empathy mapping is to really understand what the patient's goals are at each stage of their journey as they're navigating through their journey in the healthcare system, what they're feeling, what they're saying, what they're thinking, and what they're doing. And part of what we also wrap around with our empathy map is a little bit of technical components here. We like to produce the empathy map, but we also like to find really what are the stories that the patients are telling us as well, because stories are very powerful in understanding what that patient journey and experience looks like. So we really try to capture the voice of the patient, not just through the empathy map, but through their stories, and make sure that they can be used and shared with people that you're communicating to within your organization. And then the other one we do is some sentiment analysis, where we actually aggregate all that feedback from patients, their families, from clinicians on the floor, and really find what is the sentiment around that. So we do some sort of sentiment analysis as well to kind of support that. The next bit, which really...
Sorry, Jimmy, sorry, just to talk about the empathy, like I think this is so great, isn't it? Like thinking about the personas of each of these people and the different stages, because we've all got to remember why we're doing this at the end of the day, isn't it? Like we really got to think about why are we actually doing this and keeping that top of mind as we're going through these processes.
Yeah, it's a critical step, and I think everybody always means well when they're providing healthcare services, but we're at different healthcare teams and providers and people supporting healthcare come in at different stages of the healthcare system, and sometimes bringing all of that together and looking at how we can actually really make an impact to that patient and consumer. And what we've found through what's been really some of the insights we found through doing this across multiple, you know, quite large public and private healthcare providers across the country is where we really struggle within the healthcare system is the handoff points, right? From hospital going into community, from GP coming into the hospital. So you've kind of got different organizations. It's those connection and touch points where generally that's where we tend to struggle around how do we make that quite seamless and smoother for the consumers as they're navigating their journey.
Yeah, I totally agree. Yeah.
Another big bit, and I just think this is having worked in the healthcare system for so long and being very passionate about patients and consumers coming through the healthcare system, there is always a balance of certain business goals that organizations might have. And I think it's really critical that you're balancing that across what the patient experience looks like. So what we like to do is really understand, well, what are certain business goals at each stage of this journey as well? Sometimes there could be waitlist measures that organizations need to meet. There could be they're trying to look at patient flow measures as well to try and get people through the healthcare system in the right way. So it's about balance. Once again, it's about balancing it and having a real proper look at what's going on within your organization. And then the last section we like to bring into the journey mapping is understanding what are the current tools and technologies which is supporting that patient journey at each stage as well. So what are the IT systems which are being used? What are the paper or manual systems which are being used? And also who's using them? Which actors, which clinicians are using, our patients using this. So now you kind of have a really nice holistic view of what's going on within a particular health clinical service or health service.
Yeah. So to get to this point, to be able to actually create a journey map and work with you on this, like what research, what inputs do you need from, to be able to even start this process? Because it's not just a matter of sitting down on a whiteboard and mapping it out. I'm sure that there's a lot of work that goes into even getting to this point to be able to create it.
There's a lot of boots on the ground work that has to be done for this, Nicole. So we use a concept that probably a fair few people on the call may be familiar with called day in the life observation, which is really getting out on site within these areas and capturing and observing everything in its real habitat, like how does this area really work? And we'll spend anywhere from days to weeks to months, depending on the complexity and how in-depth people want to get into what's going on within their organization. We do that through a number of lenses. So it's about observing the operational flow of a clinical practice, but also what's the patient going through within that environment as well, and how do you bring those together? Another critical piece is interviews. So we do a lot of interviews with patients as well as staff. With the patients, we really focus on a lot of elements of the empathy mapping component, right? So it's really understanding. So tell us a little bit about what it was like when you first found out that this was happening and you had to go here. What was that like for you? What did you do? What were you feeling? What were you saying? What were you thinking? And we kind of navigate through that process from a patient perspective. The other bits are looking at a lot of existing documents and processes. We get into some of the system analysis as well, seeing is there any data and reports that might actually provide a lens on the type of activities that are happening within that organ. So it's all of those different inputs, bringing it together. And like I said, then really trying to focus on what's some of the hard data that we've seen through when we're doing day in the life. We do some time and motion study work, how long is a patient waiting in a waiting room, all of that kind of stuff. Do a lot of sentiment analysis, and then really trying to find what are the stories and narratives which really drive home the point of where organizations can make some significant improvements forward.
Yeah, that's so great. But so much of what happens now is like that in-person communication. It's like how you greet people, your body language you use, the tone of voice that you use, like in person, as well as how we say them as well. So how do you think this translates when we talk about digital touch points? How can we translate that and provide that really beautiful, empathetic, in-person communication when we move to more digital solutions?
Yeah, well, I think it really reminds me of I forget the gentleman's name. I'm happy to grab it and send it through with the as a follow-on, Nicole. But there's a quite famous psychiatrist who came up with a simple. I love simple rules, Nicole. I like to tell people I don't have the most up to date iPhone chip as my brain. I've still got the old Commodore 64 or one of the first PCs that were made. I'm still running on very out of date hardware. But this rule is called the 738-55 rule, and it really breaks down communication into three areas. The first one is body language, and 55% of the way that we communicate is through our body language, eye contact, the body position you have, facial expressions, those sorts of things. The second one is the tone of our voice. 38% comes through tone, and 7% comes through the words that we use. And I find this fascinating on a humanistic level, but when you start to apply that to the digital world, where we don't want to lose the connectedness with patients, how can we leverage that kind of thinking to how we're developing and designing digital solutions? And quite often, we take quite a words-based approach to how we develop IT and digital solutions. And we don't necessarily think about the body language and tonality and what do they look like within digital environments. So I think there's a lot there about what colors do you use? What avatars do you use which create a body language? And if you look at some of the really popular gamified apps, there's little things that pop up and smile and are warm, or they use quite colors. They use colors which are about creating a warm, safe environment, if that's the kind of body language that you want the app to have. So people talk about that through UX and UI, but how are we really mimicking that body language into the design of our applications, and tonality, rather than, hi, Nicole, here's your referral. That's it. It's, hey, Nicole, we just wanted to let you know we're taking care of your referral. It's been sent through
What
to
a
him,
difference
right?
that's
It's
like
such
black
a,
and white. Yeah.
it does, and it makes such a difference to the way that that person starts to trust that digital solution and application that you're working with. Once again, that's why we find through the journey mapping, understanding the stories and the empathy, it's not about stopping people's emotions. It's about understanding where they're at so you can be designing solutions to help them feel safer and more supported and understanding what's happening through their journey.
Oh, look, they're going through the most vulnerable time in their life potentially. So having empathy for them, and like you said, the tone of voice and the way you say things, whether it's in person or digitally, is just so important. I often like to think back when we're doing our own research, like when we're trying to implement digital solutions, like what really annoys a patient, like what is, have you got some examples that you can share on what you think through all of your interviews and things that you've done? Like what really peeves a patient when they're either in person or digitally interacting with the hospital system?
It's such a big question actually,
Yeah.
because um I tend to go to what's really, really hard is different things annoy different people,
Yep.
right? You'll have um, people who are like, why isn't everything digital? And then you might be working with, there's one group that we're working with, which was in an aged care sector, and a lot of the users didn't actually want to engage with the technology piece. And what was annoying them was how much they were being told everything needed to be done via a technical platform. And when we actually went into a bit further, it was that the design of that application hadn't really considered the body language, the tonality, how do they onboard people in a way where they sort of understand what was going on.
Yeah, their
So
digital
you
literacy as well,
did
right?
the digital
Yeah.
literacy, exactly. So you can really have very different people where one person loves this thing, but another group really doesn't love that piece. So then how are you actually building your systems? But one thing that comes up over and over again, um, I've felt this whenever I navigate through the healthcare system, is the amount of how many times you need to replicate the same basic information about who you are.
Yeah.
You know, this
Yeah,
is my
it's
name.
interesting, isn't it? Because we're sending them the information for them to complete, and we're asking them to fill that out every time. It could be as simple as pre-filling those forms or pre-filling that information for them, and they're just verifying it. That does blow my mind, especially if there's someone who's in the health system quite a lot. They're like, do I really need to tell you this again?
And it's what we got some really interesting feedback from some consumers around this, is they're like, sometimes it makes me worried because this is the basic part of information about me, and I need to tell people 3 or 4 or 5 or 6 times about my name, my address, my date of birth. So now when it's getting to my clinical care and I tell them once, how do I know that they actually are
Really good
keeping
point.
that information and understanding it if I'm needing to say these demographic based information pieces over and over and over again?
Yeah.
It makes me really worried about, are they across my test results, and what I told my GP, is that actually being transitioned through to the specialist that I'm now seeing, and vice versa. So when we do that, it can sometimes actually make people not have as much confidence about other components of our business too, rightly or wrongly, but that's their perception sometimes as well. So I thought that was really interesting. I never really thought about it from that angle before, but I think there could be some truth in that as well.
Yeah, I think that's where interoperability, we all talk about interoperability, but that's where this is, and the integrations with other systems. So we can start pre-filling some of this information if we are asking them to do things digitally. So I think that's definitely required. So I guess, once you've done your patient journey map, like that's done, you've done your interviews, you've gone through the process, and you think you understand, the end-to-end patient journey. Do you advocate for clients or organizations to do like a big bang approach and completely change their system? Or is it like that, some quick wins? But I guess it all needs to link back to the business strategy and the business goals that you mentioned. But, do they start picking off quick wins to make people along the journey? Or is it like, no, we're changing everything and we're going to implement this new system?
Yeah, I think there's lots of different I think views and perspectives on this, Nicole, but I've seen organizations do both.
Yep.
Um, and I think there can be you can learn so much, however, by starting with one area, right? There's a lot that organizations need to learn through doing this process, right? If you've never been through this process before, you can make lots of assumptions. You're going to miss things. There's going to be some complexities in there. And the bigger you make it, I think sometimes this is where organizations can fall into this trap. The bigger you make your initiative or project up front, unfortunately, the more that a few factors, and the big ones that I've seen in a lot of larger healthcare systems, are time and cost become real pressures. And the project becomes focused on, we've got to deliver it by this date, and we've got a fixed budget that we need to deliver it on. And then before you know it, you're starting to potentially compromise on some of the real outcomes that at the start you were really passionate about.
And that's where we go back to remembering why we're doing this in the first
Remembering why
place.
we're doing it.
Yeah,
That's right.
probably a really great time for the viewers to like ask them questions as well, because this is where we're really getting into some of this important detail about, it's great to do all of the mapping, but like, how do we implement it? So if there's anyone got any questions, like feel free to send through some Q&As as well. So once a health provider has mapped that out, like what's next, and what role does technology like a digital front door have to play?
I think the bit that I try to work a lot with organizations on with this area, Nicole, is it's important that they look at running initiatives, projects, programs, whatever they want to call it, internally within their organization, which aren't IT initiatives. I know we talk about it a lot within healthcare, but it needs to be focused on healthcare outcomes, clinical outcomes, patient outcomes, and that things such as a digital front door, it doesn't become about just putting the technology in. It really becomes focused on the outcomes. So I think there's a lot there about really getting, and what we hope the journey maps do is help organizations get clarity on what the goals and outcomes and objectives that they are. And what they realize is that solutions such as a digital front door are an amazing an enabler for them to reimagine and rethink the way that they're currently delivering their services. But it's not just the digital front door, it's actually working with admin staff, clinical staff, a whole range of different stakeholders about what they need. Maybe they need to just speak. Maybe they need to have different tonality when they're welcoming a patient to a clinic, for example. You can look at the environment of an area, and can we put more greenery in there to make it more welcoming, for example, right? So it's
Yeah.
actually when you start to aggregate all of these different components together that you really start to make an impact on the patient experience. And I think a digital front door is such a great tool to start that reimagining process.
Yeah, and that's right. So it's not a matter of like just replicating our current systems and our current paper-based systems, but how do you optimize what we're doing today to create an even better experience and provide choice?
Yes,
Yeah.
definitely.
I do have a couple of great questions here, Jimmy.
Great.
So Janet has asked, I love how you picked out what annoys the patient. So, that's a really good one. So how do you overcome any barriers for hospital admins and healthcare professionals to move from an old way of working to a new way of thinking to remove this annoyance for patients and to enhance the confidence in the system? That's a really great question.
Yeah, thanks for that, Janet. To be honest, I think this really comes down to how you start your initiative and projects. And it's so critically important, to the point I was almost making, that you don't start this as an IT project. You need to connect to the why. And that's something, and then you need to have your leadership team within your organization, your executive team, your senior clinical leaders, nurse unit managers, heads of different medical areas, really bought into the outcomes up front.
You need
And
that buy-in from all the stakeholders.
you need that buy-in. And they also need to understand that, you know, quite often within the healthcare system, there's going to be people within respective units that don't want to change from their current processes.
Yeah.
So we've done this for a couple of engagements, not something we've done for all of them, but sometimes we look at doing empathy mapping for the staff as well,
It's a great idea.
because that actually helps understand from your staff's perspective when you're looking at changing things where they could have some resistors as well.
Yeah, and I guess for them understanding why it's being implemented too, because sometimes they might be left behind and just say we're implementing this, but like bringing them on the journey, they're the ones using it as well. So if you
Yeah.
really do that uptake, that they have to be like, maybe consulted along the way as well.
And it reminds me, one of my old managers said this to me, Nicole, and it stayed with me for a really long time. But a few people may have heard of it, but it's there's a story around the cleaner at NASA was asked what their job was, and they said, I'm we're landing people on the moon, because they were connected to that mission. And healthcare is getting so busy, and so many people are overwhelmed with the busyness of healthcare at the moment. We quite often to forget to bring people along transformation journeys, right? And it's just, you need to come to training, you need to do your training, you just need to do this new thing because that's what you need to do, rather than actually bringing people into the real connected purpose of why you're doing this initiative. And a really technical component of best practice project management is a project is a temporary team. And the word I love in that is team. And so it's really important that if you're involved in a project environment, that you're doing the elements of team building that you need to do, that everybody from executive to mid-management to clinical staff to frontline admin feel like they're part of the team. So I think there's a lot of focus which needs to be put on that. So I think it's a great question, Janet. And what I'd say is don't undercook the engagement of bringing people along the journey. If you do that, you're going to have such a better outcome. If you don't, you'll be dealing with change resistance and people not adopting
Like
new ways of
everything from
working.
execs to staff to patients, like include everybody.
Yeah.
We've got another great question here. Could you please discuss on the successes and barriers you have with clinicians in implementing the solution or getting on board? Leans to a little bit with what we were just talking about, but not a bad question.
Sorry, am I still sharing my screen, by the way?
No, you're not.
I'm not? Okay.
Okay.
Um, so I think I think this kind of flows into the next point. Where I've seen the successes is with the leadership actually working with with clinicians and taking them through the journey and the processes. If that doesn't happen and you're putting that through to I'm going to call them IT project staff. A big thing about healthcare, and I feel this is something that's so critical with healthcare. It's a really strong relationship business, right? Healthcare is driven on relationships and trust with patients and clinicians, but also internally with with teams working within the healthcare system as well. It's the trust between them. So what I've seen it with a lot of projects is people try to get the trust when the project starts. So it's kind of when you want the clinicians to buy in is when you've decided that you want to do a project. I think what's really important is that you're starting to build the relationships and the trust with clinical teams in the workforce prior to that. And then the clinicians will start to trust you that you actually understand their business. You genuinely want to work with them to help their services improve it and for their patients to have a better experience, and then not falling into is this just an IT system that's going to come in and make my job harder? So I think there's a lot there about actually building the relationships before you need them.
Stephen has mentioned often the patient journey mapping is the first component of the redesign process. Great to see incorporating the patient experience and the digital components. Could you expand on the next steps in the redesign process?
Yeah, great question, Dr. Air. I think that we've had a few approaches, to be honest, and sometimes it really depends on the size and scale of the organization and the goals that they're trying to achieve. Sometimes it starts with people we feel like we've got a problem. We're not really sure what we need to do. And things like journey mapping can really help inform a strategic planning sessions for organizations. They actually want to look at strategically, where do we need to go? We need to pivot our business, or maybe we're not getting the right experiences we're wanting to do. How do we rethink our strategy of becoming more focused around our patients and consumers? This provides a really nice lens for us to have that conversation. The other one can be sometimes people are already in a project mode. They've already started a project and the journey mapping piece is coming in. Through that, it can be really, really useful to actually help define maybe what your benefits could be or some of the outcomes are that you're wanting to drive from that particular project. It can be used for a lot of people who work in architecture roles, like enterprise architecture, and actually starting to build out how all of our connected systems need to look like and where we've got opportunities to have, to use the interoperability component, but where we can make our systems talk to each other and have more interoperable workflows throughout that. So we take a very tailored approach to that, to be honest, really depending on where the organization is. The journey map might help the organization just have a better conversation about what they're undertaking, or it can also be used when you're actually in flight within a project to help you define, an architecture model that you need to do. Go-to-market strategies, people have used them for go-to-market strategies as well to actually help inform industry. This is what our patients are currently going through, and we want you as industry and as vendors to understand what we're going through and to put your critical thinking caps on about how you can help us improve patient experience with the kind of digital solutions you have out there. So I think it's actually got a real multimodal approach of how it can support organizations.
Yeah, and I think vendors, organizations, consultants, we all just need to be collaborative in that approach and work together in a partnership. And I think that's honestly when we're going to get the best outcome. When we're thinking about and remembering why we're doing it, what are we doing this for? And does it align with our business goals and strategy? So that's really important. Hannah has asked if we can talk a little bit more about sentiment analysis, if I can get that out.
Yeah, sure. So we've got some much more clever people than me that work in our organization, Hannah. And what we do with sentiment analysis is we take inputs from a whole range of different formats. And because there's so much out there now about organization sentiment. So for example, you can access data forms through what's available through the public web. You know, a lot of organizations have 5-star ratings for your organization, whether you want to or not. And there's comments which are provided through that. You can run surveys for patients, which are basically asking them what their experience has been like throughout an organization. Some organizations have things like PREMS tools, patient reported experience measures, where they do surveying and collect data through that. So when we come in, we try to find out what data points do organizations have, which has got the voice of the patients and consumers. Then we have some smart analysts that do the sentiment analysis, which is basically going through, and there's a whole range of different scoring systems that you can use. This is a positive sentiment. This is a negative sentiment. How do you actually aggregate that into how many more positive ones? And what are some of those examples? What are the negative ones? That can then also correlate through to your empathy mapping, right? So you can say, this is what they're saying, doing, feeling, etc. And this is the sentiment. There's a lot of positive, even though they're scared and unsure, there's positive sentiment that they're being cared from, or the sentiment analysis is a lot of negative words. I don't hear back about what's happening with my referral. I don't know how long my wait time is, etc., etc. So hopefully that gives you a little bit of detail around that, Hannah.
Yeah, that's great. And I've got one more before we wrap up, Jimmy, and it's from Nikki, and she said, great discussion. So thanks, Nikki. As you touched on earlier, different patients have different needs and wants in the healthcare system. How do you go about balancing the needs of different patients in the design and the redesign process?
Great question, Nikki. My approach is, and this becomes how much time and effort does an organization want to look at this? But what the approach we've taken with some organizations is we do journey maps for all of the different clinical cohorts. So then you can understand, if we've got our maternity cohort, what does that journey look like for people in that area versus oncology services versus mental health versus emergency department versus et cetera, et cetera, et cetera. So then what you have are different journey maps for those different types of consumers going through your system. And one thing we do with Evolve is we're really big on building capability within existing organizations. We don't like to be a group that needs to really stick around. We work very closely and collaboratively with existing business analysts and project staff, whoever it might be, to actually build your own internal capability. Because what we try to really recommend organizations to do is to stay interested and curious about what your consumers are going through, because it changes all the time. And a lot of the time we take a individual snapshot of, well, that's what the patient journey is. Now we're going to use that for the next 5-10 years. That gets out of date. So you need to be keeping these journey maps updated and reflected. And when you get new data in, or a new system in, or a new process, or whatever it might be, you can use these tools to actually update and reflect that. So really, it'll come down to a time and effort piece. If you want to go into a particular area that's maybe you're targeting at-risk vulnerable populations within your organization, right? You may want to get really granular and really understand what those flows look like, build out more journey maps depending on what your organization's goals are. So sometimes it's about right-sizing the tool for what your organization needs to go through. And that's something that we, very happy to help organizations, their specific needs, have a chat about and see if we can help you with the best way to approach it.
It's very much like implementing or capturing the sentiment or the personas in what's happening now. It's very much like implementing a digital solution as well, because it has to be an iterative approach. It's not like put it in today and forget it, it doesn't change, and we're going to have that digital solution in place for the next 10 years. It really has to move with the times. There's new technology, just like there's new, things that you need to map out from a patient journey perspective. So I think anything that we implement in this regard, whether it's digital or not digital, is an iterative approach of just continuing to learn, learn and listen to what's being said.
I think it's a great point, Nicole. Like I said, I've been almost 25 years in health, and some days I feel like I still don't know anything about healthcare.
Have
As
you
soon as I,
started?
yeah, as soon as I think I'm starting to maybe get a feel like there's this new area or thing that you kind of uncover. So I think we've got to be really careful of our own assumptions and views and silos. And I think the more that we stay connected and interested and wanting to learn and grow, we can hopefully do the right things to improve the care that's being provided for Australians.
Yeah, no, that's great. So I just wanted to thank everybody for joining us today. I think it was a great discussion, and thanks, Jimmy, for your time. It was really great. I'm sure everyone took a lot out of it. So what we're going to do now, as we wrap up the webinar, we are going to send out a little survey, and anyone online would really appreciate if you can fill that out, because it'll help us tremendously. And also we will send a video recording of the webinar via email afterwards as well. And we'll also share with you like the example patient journey map that Jimmy had shared on the screen before. Yeah, thanks, Stephen. Thanks. Stephen just said thanks for the opportunity to join. So we will stay connected. Thanks for your time, and I hope you all enjoyed the webinar. Thanks, Jimmy.
Thanks, everyone.
See you.